When I got pregnant with Kristen, I had actually come a really long way with the anxiety, and I hadn't had any bouts of depression for probably about 4 or 5 years. I knew, of course, going into the pregnancy that I was at a higher risk for postpartum.
Just after my husband and I got married, we started trying to have a family, and it never occurred to me that it was going to be a problem. And then it was. Each new treatment, you would come along and you would think that this is going to be the treatment that'll work for us. And then you'd get your period again and you'd just be utterly devastated. And it was like a little death every time.
My water broke unexpectedly at 19 weeks when I was pregnant with Amos. They weren't sure exactly what was going to happen, but were pretty clear that the outcome was not likely to be positive. I never got to hold her when she was alive. 2 months after Amos was born, I found out I was expecting again. And at first, I was really happy, but very quickly it became apparent that there were some difficulties with it, and 10 weeks after that, we lost another pregnancy. I found out I was pregnant for a third time in a single calendar year in November of 2014. William was born in August. It was wonderful, he was here, he was healthy, and so it was a really joyful moment, but also just a really difficult moment as well, because having him here was amazing, but it didn't change what had happened before and didn't replace the baby that we lost.
1 in 4 women have some kind of a mental health problem in pregnancy. That is, they have some form of anxiety or depression or stress. We actually don't screen and treat women routinely in Canada as part of regular prenatal care for mental health problems. The Lois Hole Hospital for Women is really innovative. There is a reproductive mental health program here at the hospital, and that program can help women who are struggling with depression and anxiety. Either they're pregnant, they're postpartum, they're undergoing infertility treatments, or they've had a loss, a pregnancy loss of some sort.
We've all heard of postpartum, but there's so many symptoms of it that I think it's often hard to recognize. And I think that it's difficult to often figure out what it is that's actually going on without having some outside help.
The first time I saw Patty at the Reproductive Mental Health Clinic, I was in a really bad place. Losing Amos was the worst thing that ever happened in my life. Things that happen when you lose a baby, like still feeling the baby moving inside you even after that baby's born. And without talking to someone who's been through that, you don't know that that's normal. You think you're totally losing your mind. And so talking to Patty, who has so much experience with other women who've been through this, made me feel like I'm not losing my mind. Actually, what I'm going through is a normal grieving process.
It was so gratifying to be taken seriously, to have somebody recognize that infertility and motherhood and new motherhood is a huge step and a huge transition, and to be able to provide somebody with some help during that time is amazing.
It's really crucial to discuss these issues, to have space and a place for women to get help when this type of thing occurs.
The ultimate picture for us really is to have screening and treatment for mental health problems be a regular part of prenatal care, so that every woman who goes to her physician or her midwife or her obstetrician can be checked for mental health problems, identified early, and good, solid, evidence-based helps put in place.
The Lois Hole Hospital is a wonderful facility, and it's an incredible resource that our community has, and we need to support it so that the programs that make a difference in women's lives are available to the women who need them.
For me, the Lois Hole Hospital, it really represents the beginning of my family, and having the support from the clinic has allowed me to move forward into the rest of my life.
This will be with me for the rest of my life, but it's not going to destroy the rest of my life. I'm going to be different, but I'm going to be okay.
There are so many people who are silently struggling. And there are so many people who are ashamed of how they feel. And I know, because I was one of them. I just want people to know that you can get better. And that life can be really, really good. And that you have the strength to do it.